inflammation of the meninges due to bacterial, viral, fungal, or parasitic infections often leads to severe complications, including neurological damage and death, if not promptly treated. The northern part of Ghana is located within the African meningitis belt, which stretches from Senegal to Ethiopia, making it highly susceptible to recurrent epidemics. The disease is characterized by sudden onset of fever, headache, stiff neck, nausea, vomiting, and in severe cases, seizures and coma. Despite efforts to control and prevent outbreaks, meningitis continues to pose a major health threat, especially in rural communities where healthcare access is limited. Mr. Speaker, several factors contribute to the spread of meningitis in Ghana, making the disease difficult to control in certain regions. Some of these factors include climatic conditions. Meningitis outbreaks are more frequent during the dry harmattan season, that is November to April, when dust, low humidity, and strong winds irritate the respiratory tract, making it easier for bacteria to invade the bloodstream and reach the meninges. Overcrowding. High population density in schools, prisons, refugee camps, and poorly ventilated homes facilitates the transmission of meningitis as the disease is spread through the respiratory tract. Poor healthcare access. Many rural communities lack adequate healthcare infrastructure, making early detection and treatment of meningitis cases difficult. Delayed medical intervention increases mortality rates. Socioeconomic conditions. Malnutrition, poverty, and inadequate sanitation weaken individuals' immune systems, increasing susceptibility to infections. Poor hygiene and lack of clean water also contribute to the spread of meningitis. Others include limited vaccine coverage, cross-border movement. Ghana shares borders with Burkina Faso, Togo, and Cote d'Ivoire, all of which experience periodic meningitis outbreaks. Movement of people across these borders increase the risks of transmission. Mr. Speaker, the Upper West region, as one of the most affected areas in Ghana with meningitis outbreaks occurring frequently, the region, geographical location, climatic conditions, and limited healthcare infrastructure contribute to the high burden of the disease. The Upper West region remains one of the most affected areas in Ghana, experiencing frequent meningitis outbreaks over the years. The region's geographical location within the African meningitis belt, coupled with harsh climatic conditions and limited healthcare infrastructure, contributes significantly to the high disease burden. Data from 2012 to 2025 highlights the fluctuating nature of meningitis outbreaks in the region. The number of suspected cases peaked in 2016 with 734 cases reported, followed by 425 cases in 2017 and 428 cases in 2018. In 2020, a severe outbreak recorded 421 suspected cases with 50 deaths, resulting in case fatality rate of 13.3%. Although the number of suspected cases significantly declined in 2022, which was 131 cases, 2023, with 97 cases, the case fatality rate remained concerning, with 10.3% in 2023. The year 2025 has seen a significant rise in suspected cases. Mr. Speaker, we're in epidemiological week 6 and the region has recorded 60 suspected cases, 14 deaths, giving a very high case fatality rate of 23.33%. This calls for urgent enhanced disease control measures, Mr. Speaker. I therefore appeal to the government, the Ministry of Health, WHO, UNICEF, and other stakeholders to mobilize technical, financial, and logistical support as a matter of urgency to enable the region to control and prevent the outbreak. Mr. Speaker, meningitis outbreaks in Ghana often result in high mortality rates due to several key factors, including delayed health-seeking behavior, emergence of new serotypes, shortage of essential medicines, limited laboratory capacity, and overburdened health staff due to inadequate distribution of health workers across the country, especially in the Upper West region. Mr. Speaker, strengthening the overall health systems in epidemic-prone regions is urgently needed to address the negative impact of perennial meningitis outbreaks. In this regard, I make the following proposals. There should be meningitis outbreak preparedness. The Ministry of Health should identify innovative ways of ensuring equitable distribution of health workers and other resources. Public health education should be implemented and enforced. Improve healthcare infrastructure to enhance the case management, investment in healthcare facilities, laboratory diagnosis, and the training of healthcare workers should be prioritized. There should be cross-border collaboration with other countries. And Mr. Speaker, the government should establish a public health emergency fund which will ensure sustained funding for current and future outbreaks. Mr. Speaker, in conclusion, the meningitis situation in the Upper West region has resulted in high mortalities and need urgent intervention by the government and other stakeholders.